Currently, digital photography has turned into a useful tool in the world of dentistry. The main advantages are the storage capacity of the images without deterioration, the immediacy with which we can dispose of them, the ability to display the quality and detail at the same time. The main utilities are planning of clinical cases, diagnostic tools, communication between dentist and patient, communication between dentist and lab technician, documentation of clinical cases. Now we are going to show the basic equipment to take oral, extraoral and facial photographs. The first element we have is the camera body. Any of the well-known brands has sufficient quality to fulfill all our expectations. We will need a DSLR camera because it is impossible to take good quality oral or extraoral pictures with compact cameras. No matter what brand you use, Canon, Nikon, Sony, Olympus, it must be DSLR. The second important element is a macro lens. The appropriate focal length varies between 50 and 100 millimeters. A 100 millimeter focal length will give us a comfortable working distance, especially in surgery. You should not buy a zoom lens, because fixed optic is a better quality lens. And the third key element is our light source, the flash unit. There are two kinds of flashes, ring flash and twin flash heads, for higher macro flash flexibility. Es el flash más versátil porque funciona bien tanto en anteriores como en posteriores, en sectores posteriores de la boca. A flash ring is easy and straightforward to use. It works well in mouths, both anterior and posterior areas. Twin flash heads have a higher macro flash flexibility, and for aesthetic anterior area, it gives us better quality pictures. When we purchase a flash, we must take into account the number guide, because it indicates the flash power. A guide number about 22 is appropriate for dental photography. We also need accessories like retractors. Retractors may be either metallic or plastic. Plastic retractors do not produce light reflections. Metal retractors can produce unwanted defects on the photographs, but they have the benefit that they can be autoclaved. Contrast sheets are not essential, but they enhance our pictures, giving a homogeneous dark background inside the mouth. We need occlusal and lateral mirrors to capture the dental quadrants and full arches. To obtain the extraoral photographic sequence, we need to place the patient in front of a uniform background and then start the sequence. First, we will take full-face extraoral photographs. Photo of the frontal position of the face. Frontal photograph of the patient smiling. Photos from both sides, right and left. We should ask the patient to turn 90 degrees, first to the left to take the right side picture, and then rotate to the right. Oblique photos, right and left. We take two oblique photographs, asking the patient only to turn 45 degrees. After obtaining the full-face photographs, we must repeat the sequence, photographing only the lower third of the patient's face. Photo of the frontal position of the face. Frontal photograph of the patient smiling. Photos from both sides, right and left. We ask the patient to turn 90 degrees, first to the left to take the right side picture, and then rotate to the right. Oblique photos, right and left. We take 2 oblique photographs, asking the patient only to turn 45 degrees. We will perform intraoral photographs with the patient sitting on the chair and we will place lip retractors. Photography in high intercuspitation. Side photographs, right and left, with the help of a contrast. Photography contrast of the superior arcade. Occlusal photographs with a mirror, top and bottom.
Fotografía occlusal superior y fotografía occlusal inferior.
Photographs of excursive movements, laterality, right and left, and protrusive.